Hello, my name is Dr. Faisal Anwar. Today we will discuss another case of phacoemulsification. Here you can see speculum is applied. We will start the cataract surgery. This is 2.8 millimeters keratome to take entry into the anterior chamber. This is a trypan blue. We are staining the capsule in this grade 3 nuclear sclerosis cataract. As the cornea is not very clear in this case, after staining we will remove the trypan blue dye from the anterior chamber. Now we will inject viscoelastic into the anterior chamber so we can perform capsulorhexis. Here you can see we will lift the flap of capsulorhexis and rotate in anti-clockwise manner. Here you can see we are rotating it, and now we are completing the rhexis in a 360-degree fashion. We are feeling a little bit hindrance in completing it. Here the capsulorhexis is complete. Now next step we will make side ports. We are doing 3-port surgery in this case. With 15-degree knife we will make 2 ports. Now we will take normal saline and we will do the hydrodissection in 2 to 3 areas so we can completely separate the capsule from the lens, cataracteous lens. Now we will try to dial the nucleus. Here you can see we are trying to dial it. As this is a case of floppy iris, so we have to be very gentle. Now after dialing the nucleus, we will take the phaco tip into the anterior chamber. First we will check the phaco, then we take it in. Now we are removing the epinucleus and the cortical matter. After removing it, we will take the dialer in from the side port, and after holding the nucleus we will chop it into 2 pieces. Now we have 2 big pieces and you can see the iris start coming out from the side port. In this case the iris is very floppy. Now the trick in this case is keep on chopping the nucleus into multiple pieces, 6 to 7 pieces, because in such case iris will not stop coming out of the port. So we are making multiple chops quickly. Keep on chopping the nucleus. In the end we will remove the second instrument and only we will remove the chopped pieces with the phaco tip. So we lift the first piece. Again you can see iris is coming out of the side port. We will try to save the iris from any trauma by keeping an eye on the iris as well. Here you can see we have removed another piece and we are again repositioning the iris, depositing the iris into the anterior chamber. You can see we are lifting another piece. If we will remove the phaco tip, iris will start coming out from the main port as well. So in floppy iris cases, you have to try to keep the instruments into the anterior chamber till you are done with the phacoemulsification. You can see we are lifting another piece and we are removing it. Again, we will take the second instrument. Again, you can see the iris is guided in, and again we are chopping it and removing the nuclear fragment. Here we are lifting the bigger piece. As you can see, we are again removing it. Again, you can see the iris is coming out. Always remember, we have to save the iris along with this phacoemulsification procedure. Here we have removed the nuclear fragments. Now again we will try to remove the epinucleus. Now the epinucleus is almost removed and iris is still in the wound. Here you can see, as we remove the phaco tip, the iris starts coming out from the main port as well. Now we will deposit the iris with the BSS solution into the anterior chamber. After depositing it, we will remove the cortical matter with the Simcoe cannula. So here we are removing the cortical matter by pulling it to the center. First of all, you have to do suction, then you engage the cortical matter, and then you displace it towards the center, and then again after displacing it to the center, you do suction. Suction is never done when you are below the anterior capsule. Here some pieces are left. We are removing those cortical pieces. So this is a bigger cortical material that is removed. Now again we are removing the remaining cortex is almost complete. Now we'll put viscoelastic into the bag. You can see we are checking the port. Now we will take the injector and inject the foldable intraocular lens into the bag. Now the first haptic is in, optical part is also in. Now we will take the dialer and guide the trailing haptic into the bag. Again we will try not to damage the iris as it will bleed. We have to be gentle. In floppy iris cases, you have to deal with the iris and the cataractous lens both at the same time. Here the case is complete. We are removing the viscoelastic from the anterior chamber. Lens is into the bag. After removing the viscoelastic completely from the anterior chamber, we will put some myostat carbachol into the anterior chamber to constrict the pupil so we can restore the symmetry of the pupil. Here you can see we are taking myostat. Now you can see the iris will constrict. Now we will remove the carbachol from the anterior chamber. So our cataract surgery is completed. Thank you.